As I said, as I began my remarks, change is inevitable. And while at times it can be unsettling, it provides us with the opportunity to evolve and flourish. Last week, as you know, Dr. Zhao announced that he will step down as chancellor on June 30th after 10 years of service to Duke to become president of the Institute of Medicine. This is a wonderful opportunity for him, and I wish him continued success. The IOM is both an honorific organization and through committees it convenes a primary source for independent recommendations and advice to policymakers in areas important for human health. There are two other significant leadership changes that will occur in the coming months. Peter Lang will step down from his role as provost in June after 15 years to return to the faculty, and I expect that a new provost will be named at the beginning of March. And Catherine Gillis, Dean of the School of Nursing, will step down in June after 10 years. A search for the next School of Nursing dean is nearing completion. In addition, leadership searches are underway for new presidents of Duke Regional and Duke Raleigh hospitals. We're very fortunate to have had such strong and dynamic leaders in all of these critical roles. Each has brought about change and progress that have positioned Duke for the future, and I'm grateful for their partnership over the past 7 years. I wish them all the best. So what do these changes mean for the school and the health system? As dean, I will continue to lead the School of Medicine, and Bill Fulkerson will continue to be responsible for the health system as executive vice president. There will be no interim chancellor, but Bill and I are committed to working together as effective partners. President Broadhead will be kept well informed and will help us as needed. I can assure you that this leadership team shares a common interest in the support and success of faculty, staff, and students, in financial stability for both the health system and the school, and in a culture that places a high value on our 3 core missions. I want to make sure that you are aware of several other important leadership changes. Carl Raven will be stepping down from his role as president of the PDC, the faculty practice, and Mark Newman will become PDC president in April. The PDC presidency has evolved under Carl's leadership, and I'm sure that Mark will make his own mark on it in coming years. In addition, I'm very pleased to report that Alan Kirk will come back to Duke as chair of the Department of Surgery later this spring. Alan, one of our MD PhD alumni, is currently a professor of surgery and pediatrics at Emory. He also serves as scientific director of the Emory Transplant Center and vice chair for research of the Emory Department of Surgery. I'm very grateful to Ted Pappas for his outstanding leadership of surgery in this interim period. He has done a superb job in managing the department and preparing it for its next phase. Searches are nearing completion for pediatrics and neurology chairs. I think that we will probably make announcements about both of these new chairs within the next month. Searches for new chairs in the departments of pathology and ophthalmology began late last year, and I anticipate that the pathology search will likely be completed by this summer, and the ophthalmology search will likely finish by the end of the calendar year. With Mark Newman's move to the PDC presidency, I have appointed Joseph Matthew as interim chair of anesthesiology, and we will soon start a search for permanent chair. As new leaders accept these important roles, they bring fresh perspectives and exciting new ideas that make the institution stronger.